Hi, this is Naturopathic Doctor Patti Sheeley at Looking Glass Integrative Wellness, and today I am with my friend Bettina, and we are doing my second ever podcast, and I am just excited to be talking about a very interesting topic that Bettina was asking me about, which is mold, and we'll be talking about that here in just a moment. But in the meantime, I wanted to let Bettina introduce herself in her own words. So tell us a little bit about yourself, Bettina.
Yes, I'm from Germany, from Berlin. I was born in East Germany, and I experienced there the fall of the wall, and that was actually during my training to be a nurse that the wall fell, and I met my husband just one year after I graduated, and then I still worked for half a year. And then we got married, and we were all over the world, but later went to America because that's where he's from. And I love America. America is the freest country on earth, and I love that. And so, from the background of conventional medicine, coming from there, we encountered some health crises, and we saw the great necessity to know more about holistic approaches to add them to what we were doing with conventional stuff, for example, cancer and cancer treatment. And so now I'm such a fan of holistic medicine that that's been my passion, and now I'm so glad I get to work for Dr. Sheely sometimes when her wonderful assistant is taking a vacation, and I get to learn so much more here, so much more than I didn't, more than I ever knew before. So I'm very grateful to be able to have this opportunity to ask questions.
Well, Bettina brings such light and fun and curiosity. She does a very good job of keeping me on my game, but also just challenging me to think deeper because she absolutely understands so much because of her nursing background. So, with no further ado, let's jump into the topic. Bettina, what were you curious about today?
Well, I wanted to ask, how does a person realize, how does a person realize that what they're really dealing with is mold when the symptoms can be like coming from all kinds of directions? So you end up with lots of doctors.
Yeah, and that's a great question because mold is like this mimicker of things, and it mimics everything from hypochondria, where you think you're sick and you're really not, to it can be very much like Lyme disease. It can be like, I don't know, just it depends on kind of what part of the body the mold is attaching itself to. It can be skin, it can be sinuses, it can be digestive, it can be other things. It also can look like urinary irritation. It can look like digestive. It can look like a liver problem, right? And it does actually toxify all those organs and more, which is why it does that. But one of the things I like to do, I have an inventory, which if you're curious and you're listening to this and you're like, I want to see the inventory, I want to do it. It's a preliminary, very rough screening that somebody that's done a lot more mold work than I have. I'm doing more and more all the time. And I'm becoming mold competent. I guess I do have passed the certification, but I view competency as a lifetime thing. So I'm competent. Well, yeah, I'm becoming more competent all the time. But one of the ways you can determine that is when you are in certain places, are your symptoms worse? And take note. So sometimes I'll have somebody who's like, when I am in a very warm, sunny environment, when I'm in the sunroom in my home, or when I am outside on a sunny day, whenever it's really, really hot, I feel my best? Well, most of us, if we don't have something that's happening within the internal environment of our bodies that would respond to that, most of us may not feel that our best when it's 109 degrees outside and we're out standing in the sun, right? So that would be a bit of a tip off that maybe there's something that when we are exposed, maybe there's something in the in other environments that is happening that we're not really. Mold doesn't like sun, and mold really doesn't like hot, dry sun, especially, right? So in that kind of an environment, then you're like, oh, I feel my best. Well, that may be mold. In fact, there's been a time or two I really don't like to tell people it's probably mold, because I know that they're going to probably have to really look at their home and work environment to see where it is. And that can have ramifications with construction and ripping out drywall and all that kind of stuff, because avoidance is very important for mold. And so I know that it's going to be kind of a heavy load for them to get going on getting better. So I really don't like to say it's probably mold. And I can remember a time or two whenever I just ask the question, where do you feel your best? And anytime it's someplace hot, dry, and sunny, but generally unpleasant, like insane heat or something, I know, like, well, that's where we have to go, is mold. So if is it environmental, mold will tend to accumulate in one of several places. The most common places are the sinuses and the gut, but it's also going to affect the bladder. So there are certain areas of the body, and mold is going to tend to kind of stay put in a particular area. So something like Lyme is going to have wandering things that happen all over the place, whereas mold is going to be like, oh no, you've got a lot of this particular mycotoxin that, let's say, it makes you an airhead. It can affect memory, it can affect nerve function, it can affect a number of different things, but it's going to tend to localize in a system and yet be somewhat of a mystery. So you rule out the usual suspects and it doesn't respond, and you keep having this problem with this body part. It might be mold. Does that answer your question?
Yeah.
Okay.
Yeah, very well.
All right, next. Did you have?
Then when you have an idea that it is mold, where do you start?
I always start by informing you.
Mm-hmm.
The more informed the person, because you know your life better than I know your life, right? And so we want to test the person to go like, do you have an ongoing immune response? It's not as important what you're exposed to as what your immune system is doing with that. So for example, let's say you sit down to dinner and everybody at the table eats cheese, and it's good cheese. It's not a bad quality cheese. Well, everybody at the table is eating mold. I mean, that's just the reality. But some of the people at that table will react to that mold. But if we did a urine test of everybody at the table who just ate the cheese that is normal cheese, it wasn't like nasty, gross, been sitting out too long cheese, we would find elevated mycotoxins in the urine for every single person, because they just ate mold, and mold produces mycotoxins. But only the people that are mold sensitive would react to the cheese. And even all the people that are mold sensitive wouldn't react necessarily if it's. So my point is, like, I'm not real concerned about eating mold food. Although if it has obvious visible mold, please don't eat it. That's a bad idea. But I'm interested in what is your immune system reacting to. And that is largely genetic.
Mm-hmm.
There's a very significant genetic component to that. So 5 people can be in the same environment and only one of them will feel anything. So I was in a home, and I won't name whose home, and I'm mildly sensitive to mold. And so I was in this home and I looked down, and there had been a water leak, and there was evidence of mold in their flooring. And I was like, oh, for me personally, it was mental note. That's why I'm having a runny nose right now. I'm not coming down with a cold. It's not some external allergen that's, outside, some kind of pollen or whatever.
Mhm.
I knew like I'm in this environment, I'm being exposed to mold in this context, and it's one of the ones that I personally respond to. And I had a drippy nose. For me, it was that simple. I left, and within minutes, I was fine, and I felt fine pretty much the whole time I was there. I just had a drippy nose. But somebody who is very, very mold sensitive would have been made sick, possibly for days, as a result of being in that particular environment. So it's a highly unique situation.
Mhm.
So we want to check that individual's immune system and how strong is their response to the mold currently. Because and that will tell me you're around mold all the time right now,
Mhm.
because it'll tell me the immune system is activated. So that's the IgE response says the immune system is activated, and the IgG response says the immune system is just generally activated. And then the IgE response says, and you also have mast cells that are getting really, really busy. And the mast cells are things that can make you extremely like itchy, or have severe respiratory symptoms or whatever. And then, but what that doesn't tell me is, where is it? Is it in a biofilm in your sinuses? Is it environmental?
Mhm.
Is it in your gut? Is it in your urinary tract? I can't tell. And so it's very kind of annoying. So after we go like yes reacting,
Mhm.
then it's important to have your living environment, possibly your work environment, possibly even your car checked. And so that's whenever you get down to the detective work. And that's kind of a different wheelhouse. And I just help like, this is where you go and ask to do that. If it was a recent, like, leak in your home, maybe you have a leaky roof or something. The good news is, if it's recent, your homeowner's insurance will help you. If it's not recent, then that's a different situation. So checking the environment is super important. And a lot of times, if you are a moldy and you realize I have mold problems, then you observe like, I feel worse over here versus over there. And plenty of them go like, it's got to be close to where the dog sleeps at night or whatever, because that's where I feel worst in my house. So I like to have my moldies kind of help sniff out where to look, because it can be behind the drywall and you
Mhm.
can't see it. And the most toxic mold forming um, mold varieties, you can't smell it.
Wow. Can
So,
imagine.
so where to start? We kind of start with you, then we look at the environment.
Mhm. Wow. Thank you. And then I have another question. Um, what kind of supplements would you use to get it out of the system? Like
Mm.
biofilm, I guess. And
Sure, sure. Well, we don't start with supplements. We
mhm.
always 100% of the time we start with elimination. Um, the person that I kind of I follow a few people, but Dr. Krista talks about it like kind of an orange. And the first step in the orange, peeling the orange, right, is elimination. You have to get out of the environment. You have to get separate from external mold,
Mhm.
because it's going to just keep retoxifying you, and you can't. It's kind of like um if you didn't take a shower, what's the point in putting on perfume? It just is not good, right? It's nothing that you take externally is going to fix exposure. So exposure always has to be priority one. The second priority, and it's a non-negotiable, it's not a matter of take this supplement to mask that symptom. The next priority is what we call in naturopathic circles the determinants of health. So some of those we can change and help, and others we can't. For example, I do not have the health of a 22-year-old person, as much as I would like to. I cannot turn back time. I can be really, really good for a 50-something-year-old person. Um, but there's things that I'm not going to be able to do in my age group that a 22-year-old woman would be able to do. One of those would be, oh, I don't know, making a baby. That ship has sailed for me. Doesn't mean I can't be the best person in my age group that I could. It just means I can't turn back time. And so that's one of the determinants of health. So there are certain things like that we can't change. Can't change our genetics, but we can change our elimination. So one of the biggies is the pathways of elimination, which would be things like sweat, urination, exhaling, and of course pooping. Right? Those are our major pathways. There's others, but those are the majors. And then we also want to make sure we're hydrated, that we're moving, and that we're nourished. So you want to have a good, clean diet and make sure that you're able to digest that food, so that you have the food that you're getting in is being absorbed appropriately, and not in a way that you can have the best diet in the world, and if your digestion is bad enough, it's still toxic no matter what you eat. So all those things are super important in order for us to move on. So once we get past those two layers that are absolutely non-negotiable, and neither one of those are a pill that we take. And you can't skip step 1 or step 2 and go straight to the supplements. It doesn't work. Okay. So beyond that, there's different things that we can do. So there's the sort of supporting the body's systems. There's the antioxidants. That would be things like NAC, quercetin, your B vitamins. You want to eat a rainbow of fruits and vegetables, absolutely, but also appropriate amounts of vitamins and minerals. And that's going to be somewhat unique between individuals. But we just want to make sure you get appropriate amounts of antioxidants. But then you also have to watch for, like, glutathione is a fabulous and amazing and wonderful antioxidant if you tolerate glutathione, but some people don't. So it's a little hard for me to go like, everybody should do this, because I do individualized care, because we're all individual. And what is amazing, rockstar, stellar, game changer for one person can make other people sick. Some people, and mold toxicity it tends to make you sensitive to a lot of things. So I have people that I really think when we get them on antioxidants, what happens is the body goes like, oh, and now I can download more of the mycotoxins, and then they actually feel sicker. And so it's a very sort of whack-a-mole kind of thing to help people with. The next thing in terms of supplements is, yes, absolutely, I'm in favor of addressing a biofilm, but we probably should begin to address the surface level things that are more like presenting. I can do that a lot with essential oils in the nasal cavity. And I can do a lot with herbs, and I like to rotate those. So I do custom herbal formulations. So Paul d'Arco is great. I like thyme as an herb because it reduces the amount of mycotoxins that existing mold puts out. I do not like it alone. I want it to be a team player. If you're just like, well, what's a thing that I can do? One of the things I like to suggest to people is green tea, up to maybe 4 cups a day. And the reason why green tea is because it helps break down mycotoxins. And so I'm always in hopes that it will reduce symptomology. But also there's prescriptions. It's really great to pulse certain prescriptions that you can talk to a mold literate doctor about, as well as in my clinic, I have an ozone generator, which is fabulous. So I like to do like, okay, this is our antioxidant package. And then we vary our herbs between different things. And then we also bring in ozone and do that. So we're always changing, because mold is a great adapter. And so whenever we address mold, it's a really good idea to change our game plan. But again, I cannot stress well enough. Avoidance is really non-negotiable, and it's step one. And I'm not interested in killing what's in you unless we address what's around you. Does that answer your question okay?
Yes, it does.
Do
Thank
you
you.
have any other questions for me?
So I don't know much, I don't really know anything about how ozone works there.
Ozone is amazing. I mean, it's oxygen and oxidative therapies is actually the kind of the most powerful antioxidant that we have. But if you think about it, like if you're going to sterilize a surface, even in a medical setting, a lot of times you'll use peroxide, right? Peroxide is a very strong antimicrobial, and ozone in the body is, well, it's a reactive oxygen species. That's what that is. And so what that does is it goes after pathogenic whatever bacteria, viruses. I know of people who during the COVID pandemic, whenever they had an ozone generator and they'd come in and they would you can't just breathe ozone in because that will damage your lungs. So we use it in certain ways that is safe, but they knew how to do this safely, and they would actually use their ozone generator to bubble some olive oil, and they would inhale the what they call the ozonoids, and it really helped their family during the COVID pandemic. So bacteria, viruses, all those kinds of things have trouble surviving in that reactive oxygen species environment. But it also has an added benefit, which is to help break down the mycotoxins, which mycotoxins, I haven't defined that very well. Mycotoxins are the poison that the mold puts out. So a particular variety of mold will produce the specific mycotoxins that that particular variety of mold produces. And it's not as simple as this mold, that mycotoxin, because there's variation between, I don't know, aspergillus will do a certain number of different ones. And so there's different strains that make different mycotoxins within the mold category. But yeah, so I like the ozone because, like I say, it kills pretty much everything that I know of, and also it breaks down a lot of those mycotoxins, which gives people immediate relief.
Wow,
Yeah.
that is so good. And you offer
Yeah.
those ozone
Yes.
therapy.
Yeah. I don't inject ozone. It's not within my scope in Oklahoma. But I am able to administer through other routes, and we get good results from that.
Wow. Thank you very much.
You're
This was very
welcome.
informative.
Okay. Well, hey, thank you, Bettina, for participating in our little experiment, and thank the audience for listening. This is Naturopathic Doctor Patti Sheeley at Looking Glass Integrative Wellness, signing off and wishing you all the best.